Hello, I'm back. Let me continue with the pathology of the female reproductive system. In my previous lecture, I covered the inflammatory process, that is pelvic inflammatory disease, that is the PID, and I went through little details. And today I will cover the uterine pathology. Okay, let me clean this part because I need a space to use for that other part. Okay. One thing I just want to share with you, that always try that how nicely you understood the materials, how much we understand, how much we can talk. That's not the prime interest. Prime interest in ultrasonography is whenever you do it competently, perfectly, because you are learning the diagnostic medical sonography. Okay, whatever you learned, you know it perfectly. That is very important. And okay, so now I will go over the uterine pathology. Before going to uterine pathology and its congenital uterine anomalies that I will cover today, I want to understand first the developmental process of the uterine pathology, female reproductive organs. That is very important. In my previous lectures I did, but you might forget, but I want to remember. I want to remember, and I want you to remember that developmental process that is called embryogenesis of the female reproductive system. If you understand that embryogenesis perfectly, then these are the congenital anomalies will be very clear to you. Always keep that in mind. Try to correlate patient's chief complaint and history, patient's signs, symptoms, and your physical examination and your findings in ultrasonography. When the theme of these three match together, then you will see your diagnosis is just one step ahead. Okay, so this is very important. So now we learned that the female reproductive system is developed from the Mullerian duct, and the other name of the Mullerian duct is paramesonephric duct or tubules. Okay, little embryology, embryogenesis. Of female reproductive system. Okay, they are developed from the two paramesonephric ducts, or you can say tubules, paramesonephric tubules, so one pair. And when they appear parallelly, vertically in the pelvic area, where also mesonephric tubules are there. You remember the kidney develops when in the pelvic cavity they develops, and it takes a couple of weeks, and there are three stages they have to pass: pronephros, mesonephros and metanephros. The pronephros starts with 6 weeks, and by the end of the 7 weeks the metanephros ends. That means 5 days, the first two phase. Mesonephros, say 1 week, metanephros 1 week, and by the end of the 7th week to the end of the 13 weeks, this is the time for the metanephros. This metanephros is a process of forming the functioning kidney, because by 14th to 16th week of by LMP the kidney starts functioning. Okay, so now kidney has a collecting system, and the mesoderm, that is the cortical part, tissue part, parenchymal part. Kidney also developed from the intermediate mesoderm that forms the parenchymal part, and the tubular, the mesonephric tubules, they form the collecting system. The collecting system is the minor calyx, major calyx, and the renal pelvis. Okay, so these are the tubules, the nephrogenic tubules. They form the rest of the collecting part, and as a result the collecting system comes first, and then mesoderm comes next and forms the kidney. Now we have to understand. So this kidney formation and the reproductive organ formation. Kidney formation we call it urogenic, and reproductive is genital. So now these two systems origins from the one same tissue known as urogenital ridge. Urogenital ridge. Urinary part comes from the uro, genital part comes from the genital. So urogenital ridge. So now these are the common source for the two systems. So now my question, if the common source is defective, so then kidney system will be defective, as well as the reproductive system, female reproductive system will be defective too, and the male reproductive system will be defective too. So now, what is my clinical interest of knowing this concept? The point is that if you see the one system has a congenital defect, please check the other organ, other system to see is there any congenital defect on it or not. Keep that in mind. Our testicles and the ovaries, they are also derivatives of the ridge, urogenital ridge. Okay, so, and that urogenital ridge forms by the intermediate mesoderm. So we need to check the kidney system, we need to check the female reproductive system, ovary, and the male reproductive systems too. Just let me give you one idea. If in male, if one-sided seminal vesicle is absent, on that side the kidney is also absent. So now you have to understand, so that why? Because their source are the same. Okay, so now two paramesonephric duct. Para means by the side. By the side of the mesonephric ducts, two tubules appear. Okay, two tubes appear and they fuse at the middle part. And now this part will be cervix, body and fundus. And this two part will be fallopian tube, and these two will fuse together, will form the vagina. Okay, let me show you the next step. Okay, so now look at here. This two is this. Okay, and this one, I'm giving the plus sign, plus sign, plus sign. So this area is this. This, and this one I'm giving the division sign. They unite together and forms this. Okay, so now finally what happened? This is vagina. So this part is cervix, CX, and this part is body, and this part is fundus, and these are fallopian tube. Okay, so now this fusion and joining, dilatations and separation, all those mechanisms are a series of changes, and finally it forms with the structures. Those are the fallopian tubes, uterus, that has fundus, body, cervix, and the vagina. If there are no two mesonephric tubules or ducts, only one, or when individually they decide that we will grow ourselves without fusion each other, so then individual tubes will grow and will form one small uterus with one horn that has a fallopian tube, and then small cervix and small vagina. So there will be then two small uterus and the two horn, one from each uterus, and two cervix and the two vagina, we call it didelphys, uterine didelphys. And if this fusion and then growth and development, if fusion is there but the growth and development is halted, stunted, so then perfect size of the uterus may not be seen. Okay, so this is the mechanism that it has to be fused together in order to get the normal size of the uterus. Now get the idea. If only one tubule forms the uterus and another tubule did not appear or fail to develop, then uterine size will be bigger or smaller? Smaller. Hey, what is the problem of the small uterus? There is a big problem. Why? Because the uterus may be ruptured when it is a gravid uterus. Full-term pregnancy, it may not accommodate, because we learned that when the uterine wall thickness is less than 5 millimeter, there is a chance of rupture. And if uterus has C-sections before and then it after next subsequent delivery labor, the pregnancy uterus wall can be ruptured at the site of C-section. Okay, so a lot of challenging happens, but keep that in mind. If you ask, is not possible at all to have a baby in the small uterus? No, I will say yes, it is possible. It could be small for gestational age, or you have to take the baby out after 32 weeks. Why 32 weeks? Because the baby's lung mature happens by 32 weeks. That's why they will take the baby out while the lungs are matured. They will find it by the test, and the baby will be cared or nursing nicely out of the uterus. So the chance of baby survivability is more. Okay, so now I'm going to discuss one important things. Did you notice there is a nice dome of the fundus, and the body is dilated, wider here, and the cervix is getting narrower. Okay, giving the external os, internal os, and this is called isthmus, and this is the cervical length, and it has an opening is going to the fallopian tube, the endometrial cavity, and this fallopian tube. And as you know, the uterus has 3 layers in the wall: perimetrium, myometrium, endometrium. And uterus has 3 parts: fundus, body, and cervix. Right? So now, if the uterus feel like, oh, I will make some architecture inside, what architecture, what design you want to do, then uterus says, I will keep the dome as it is, but I like to make it little septated, giving the heart shape inside, but externally you're not going to understand what is going on inside. That may give you the subseptate uterus. I will draw it, I will explain it. Okay, so in that way there will be biconnect uterus. That means 2 uterus, 1 cervix. Uniconnuate, that means only 1 fallopian tube, 1 mesonephric duct develops with 1 fallopian tube. And then uterine didelphys, that means everything is 2 fallopian tube, 2 uterus, 2 cervix, 2 vagina. And the T-shaped uterus, it is a very small uterus. The cervix is there, and over the cervix the fundus and body is horizontal, and the pregnancy is not possible in that uterus. And gyneatricia. Gyneatricia means so no development of the female reproductive organ, especially the vagina. Okay, so it is a challenge because it's not uncommon. The part of the vagina did not grow, did not develop, or even the hymen is not perforated. We call it imperforated hymen. And uterus may be formed the full length or may not be formed in full length in the upper part, middle, or the lower part. Then what is the problem? I will discuss over there. Okay, so now let's go with the gyneatricia first. Okay. Atresia means failure to develop. Atresia. So normally what happens? We see the uterus, this is nice uterus, the fundus, body, cervix and vagina. Okay. Now if it happens like this, that this part of the vagina failed to develop, okay, so now this part, the middle part, did not develop. Or it could be the proximal part or distal part did not develop. So if the patency, understand, if the patency is not there, so then what happened? A girl that have a menarche at 13 years of age, every month subsequently they will have bleeding, but where is the bleeding going? So they all will be collected here because they cannot pass. So then you will see they will develop the blood here, and finally it will be very dilated. Okay, you will see the upper part of the vagina is dilated. We call it hematocolpos. Hematocolpos. And if only here there is a disconnect and the rest of the this part is present and the bottom part and there is a continuation of this. So then what going to happen? This will be filled with blood, hematocolpos, and eventually it will be filled like this. These are all blood. What blood is it? It is the menstrual blood, okay? It couldn't come out. Don't you think it is a very painful and pressure effect? Yes. Very painful and pressure effect. And everybody will be very worried. The girl will come with the mom to the doctor. Mom will say, my daughter is 16 years old, 14 years old, but having no period yet. And they will feel it that there is some mass above the symphysis pubis. They can feel it and they feel like, oh my God, it feels like the girl is pregnant, but she is not. Why? Because when this pressure will go up, then this blood will start coming through the cervical canal. Cervical canal. And finally, what happened? The uterine cavity will be filled with blood. And when it will be more and more, then uterus will start getting bigger. Uterus will be bigger. And more the uterus is bigger, and then finally the endometrial cavity will be bigger like that and is filled with blood. So this is CX canal, is dilated and filled with blood, and this is blood in the uterine cavity. Too much, we call it hematometros. And when both hematometros and hematocolpos are together, we call it hematometrocolpos. Okay, we need to know this term, hematometrocolpos. And in the exam, board exam, you will see this type of picture. And this collection is totally anechoic, but you can see internal echo because of the blood and blood clot, and in the uterus you will see anechoic. There might be some internal echo, but this is definitely an retention of the periodic blood within the upper part of the vagina and the cervical canal and inside the uterus. Okay, so this is mainly known as gyneatricia, failure of development of the vagina, partially or fully. Okay, so sonographically we can see this. Okay, if this is